And I am calling the Board of Psychology the second day of our meeting in Riverside to order. And Ms. Whitney, can you please call the roll?
Tate,
Here.
Rogers, Kasuga,
Here.
Cervantes,
Here.
Harbsheets,
Here.
Fu, Nystrom,
Here.
Riscate.
Here.
Thank you. Quorum's established.
Thank you so much. Just a few housekeeping items. The restroom is out to the left and right before the elevators. All of us are on computers. This is where all of our board meeting materials are. So that's our effort to decrease the amount of paper utilized. Also, what else? I will be departing at 9:25 this morning due to airline issues, but I will leave you in the capable hands of my esteemed colleague, Dr. Harbsheets. And lastly, Mr. Pope, can you please let us know about the appropriate way to document our CPD?
Thank you and good morning. Attending today's in-person board meeting provides you with CPD credit under category number 1, attendance at a California Board of Psychology meeting. Since today's meeting is designated as an in-person meeting, CPD credit will only be given for in-person attendance, and CPD credit will not be given for viewing the meeting through the WebEx, as the WebEx is for streaming purposes only, and there is no option to interact during the public comment periods. For attendees who are in person with us today, the sign-in sheet provided will be the board's record of your attendance. Please sign in and out as needed for today's meeting. For your CPD records, please notate today's date as November 7th, 2025, and note that we are here for the board meeting. Please maintain this record, as certificates of attendance will not be provided for attending today's meeting. At the end of today's meeting, I will announce how many hours will be credited for attending the full meeting. If you must leave before the meeting has adjourned for the day, please sign out and you will be credited for the time you attended. Again, at the end of today's meeting, I will announce how many hours will be credited for attending the full meeting in person. Thank you.
Thank you, Mr. Polk. We will be jumping to agenda item number 24, the election of officers, and I will be handing this off to legal counsel, Ms. Ganaway.
I just wanted to add, John Burke, the executive officer, just wanted to say that Dr. Rogers, who is our vice president, apologizes for her absence, but she was unexpectedly unable to attend today's meeting. I've spoken with her, and she did say that she will accept the nomination for vice president should a nomination and a second occur during the discussion the board members are about to have. Thank you.
Thank you. Okay, well, we're going to go in alphabetical order to see whether anybody has a nomination. And once we have a nomination in a second, then we'll proceed with the vote. Dr. Kasuga, you're first.
Thank you, and it's an honor to nominate our current president, Dr. Leah Tate, for a president, and just one by one or together. All nominations.
We'll go with the presidency first, and
Okay.
we'll go to the next position.
Thank you.
Is there a second for?
Second.
I'm sorry. Who is seconding? Julie. Julie. Now we will open for public comment. Does anyone have a comment on the nomination for Dr. Tate for president? Seeing none, are there any other board comments before we move to the vote? Seeing none. Cindy, could you please take the vote?
Tate,
Aye.
Rogers, Kasuga,
Aye.
Cervantes,
Aye.
Harbsheets,
Aye.
Fu, Nystrom,
Aye.
Riscate.
Aye.
Thank you. Motion passes.
Now we'll go to the nomination for vice president. I will go back to Dr. Kasuga. Do you have a nomination?
I do. I nominate our incumbent vice president, which is Dr. Shakanda Rogers, for vice president of the board.
I'll second that motion.
We have a motion and a second on the floor. Is there any public comment on the nomination of Dr. Rogers? Seeing none, are there any other board comments on the nomination for Dr. Rogers? Seeing none, Cindy, could you please do the vote?
Eight.
I'm sorry, just as a point of information, I'm not hearing you ask if there are other nominations.
Well, once you have a motion, you don't have to ask for other nominations.
Okay.
But that's why I asked if there were any other comments.
Okay.
Do you have another-
Understood.
Do you have another nomination?
No, I don't. I
okay.
just wanted to clarify.
Yes, if it was voted down, then we would have asked for any other nominations.
The other reason I want to clarify is because you're asking for the nomination in alphabetical order. And so then it always goes to Dr. Kasuga first, and it doesn't give the other board members an opportunity to nominate.
That's why I asked for board comments, so that anyone could comment on that as well.
That's my comment.
Okay, thank you.
Tate,
Aye.
Rogers, Kasuga,
Aye.
Cervantes,
Aye.
Herbsheets,
Aye.
Fu, Nystrom.
Aye.
Frascati.
Aye.
Thank you. Motion passes.
Thank you. We will now jump to agenda item 22. This is the regulatory update, review, and possible consideration of changes, and I will be handing that over to Chairperson Kasuga.
Thank you, Dr. Tate. We are gonna go to agenda item number 22A, regulatory update, review, and possible consideration of changes. We will discuss and possible action on proposed changes to language to the disciplinary guidelines and uniform standards related to substance abusing licensees. And I call on Ms. Pencia to start us off in this agenda.
Thank you, Dr. Kazuga. So the status of the package, it is in the production stage. At the board's request during the August 22nd, 2025 meeting, the Enforcement Committee met on September 26, 2025 to review and discuss proposed updates to the board's probation conditions and processes. The committee considered several key changes, including making the psychological evaluation an optional rather than standard term of standard probation condition, clarifying 2-year probation tolling provision, adding new provisions to allow voluntary license surrender with reinstatement petitions permitted after, such as 3 years for surrenders that are not related to mental or physical illness, or 1 year for surrenders due to mental or physical illness. Additionally, standardizing probation terms to a consistent period of up to 5 years, shortening the time frame to secure a practice monitor from 90 to 60 days. Board staff requests that the board review and approve the proposed revisions to Section 1395.2, Article 7, Division 13.1, Title 16 of the California Code of Regulations.
Do I hear any motions?
So move.
Do you have any questions?
Could you state your motion, please, Dr. Tate?
To accept the changes as written.
Do you have a question?
Could you list the changes again?
Yes. Okay, beginning with making the psychological evaluation an optional rather than standard probation condition, clarifying the 2-year probation tolling provision, adding new provisions to allow voluntary license surrender with reinstatement petitions permitted after 3 years for surrenders not related to mental or physical illness, or 1 year for surrenders due to mental or physical illness, standardizing probation terms to a consistent period of up to 5 years, shortening the time frame to secure a practice monitor from 90 days to 60 days.
And this was a follow-up from the last board meeting's discussions.
Right. Yeah, we had some discussion about this, though.
Microphone.
Right?
Yeah,
We had some discussion about this. So I guess when the motion is on the floor, we can have board discussion.
mhm.
Yes.
Okay.
So we have a current motion from Dr. Tate to accept the changes to the disciplinary guidelines. Do I hear a second?
So moved.
So it's been moved by Dr. Tate and seconded by Dr. Cervantes, and we can have some discussion from the board. Dr. Harpsheets?
Okay, I at the August meeting had indicated two particular concerns I had. I think realistically, giving a 60-day time frame to find a practice monitor is unrealistic, recognizing what is happening out in the field. It's difficult to find a therapist sometimes, even in that point, even in 60 days. So I object to the idea of reducing that amount of time. And also, sometimes we have disciplinary situations that don't really, in my opinion, warrant a psychological evaluation. So to make that a standard doesn't make sense to me. It's very expensive. And so, for example, somebody who misses a continuing education, it's not hard sometimes for people who submit 36 credits of continuing education, and then on an audit they're reviewed, and it's found that, gee, one of them didn't quite meet the guideline. Whether it's a addition error or it's provided by an entity that isn't included in our regulation, and those are sometimes oversights. So asking for people to have a psychological evaluation, which is extremely costly, and it doesn't seem necessary when there's an oversight. So it worries me to make that a blanket rule.
Can I ask for clarification? I thought the change was to take it from the standard to.
Wait,
It's an optional.
It was the opposite. So we were taking it to making it optional.
oh, you were making it optional. Oh, I
Yes.
didn't hear that.
Yes.
Oh, I'm sorry. I'm sorry. But the 90 days, are we back to 90 days?
So the very original text says 90 days. And then when we brought it to the board, it said 30 days because in
Right.
between the
You're
2020
going with 60.
and now in the compromise was 60.
Okay.
So it came to enforcement
Okay.
committee, and
And you went to 60.
yes.
I still like 90. I still feel like 90 is 3 months. It goes very quickly. So I would still ask that we think about 90.
Thank you, Dr. Harpsheets. Any other board comments?
I have a question of process on the issue Dr. Harpsheets raised. If someone is not able to identify oh my gosh,
I say, oh, a practice monitor.
a practice monitor
Yeah.
in 60 days, maybe they're close, maybe they're still working things out, and day 60 hits. What would happen in those circumstances?
It would be on a case-by-case basis, but generally, in my experience, we would, if someone has been making a good faith attempt to find a practice monitor or someone to do a psychological evaluation, depending on where they live in the state, that can be quite difficult. We would generally grant an extension. No, okay, yes, we can see you've tried to, you've made a good faith effort within this time period. It's not been possible for you. Have another 30 days or 50 days, just make sure you do it. And of course that people are generally motivated because they can't actually begin their probation period until this is all secured.
Mr. Burke, do they, if somebody has to find a practice monitor, can they meet with them through video means? Does it have to be in person?
It's a great question. I'm going to invite Daniel Phillips, our enforcement manager, to come up because I don't know.
That would widen the scope of people who could be available.
So hello. So your question was video or in person?
Yeah.
Yeah.
That was Dr.
That way, if I'm living in San Diego, but I can't find anybody in San Diego because we can't have a practice monitor that we already have had a relationship with, right?
Yes.
So I could maybe meet with have somebody in Los Angeles and do it through video.
Understood. Yes. Our probation monitor permits video.
It does.
She does. Yes.
Good to know.
And Mr. Phillips, do we need the contact? Did it have to happen in the 60 days, or is it just providing the name of the person the individual intends to identify?
So the probation monitor just needs the name of who she would, or who the individual would like as the monitor.
So providing the name is sufficient within the 60 days?
Correct.
Thank you.
And it can be video or in person.
Okay.
So.
Good.
Thank you.
Does that help?
Yes, it expands the scope
Mhm.
of potential practice monitors.
And I think just providing the name
Mhm.
is
Provide-
helpful.
Thank you.
Any other board discussion before I open it up to the public? Seeing none, let's open it up for public comments on the current motion.
Okay, is this on? Okay. Hi, I'm Dr. Elizabeth Winkleman with the California Psychological Association. And I want to thank the board for the changes that you're considering now in response to the discussion that was had at the August 22nd, 2025 meeting. CPA expressed serious concerns both in our August 14, 2025 letter and in our verbal comments at the board meeting in August. And we requested several changes that would make the disciplinary guidelines more flexible and proportionate, especially in how more minor violations are addressed. And over 100 psychologists wrote in to support our concerns, voicing the same concerns, and several also attended the meeting in person and raised concerns. So again, I want to thank the board because most of our issues have been addressed in the current draft, and in particular, we're pleased to see that the current draft allow probation terms of up to 5 years, as opposed to the originally proposed fixed minimum of 5 years, and that psychological evaluations are optional rather than a standard condition of probation for the reasons that Dr. Harbsheets had mentioned. We also agree with Dr. Harbsheets that we appreciate that the proposed 30 was increased to 60, but we would recommend that that 90 days be maintained because we have heard from people who've had trouble locating and finding somebody to serve as a practice monitor. So, and I hadn't realized they can't even start their probation until they have one. So most people are going to do it within that time. So just having a little more flexibility instead of, creating that additional strain of having to maybe ask for an extension and such, we think that would be preferable. But again, we really appreciate the main concerns we had, which was the up to 5 years and the psychological evaluations being optional. We do request, there was one item that at the August 22nd meeting that was not discussed in detail, but we raised, and that is the spectrum of administrative actions. So currently, the spectrum of administrative actions is posted on the board website, but we urge that the board include it in a reference to the spectrum of administrative actions within the disciplinary guidelines. The document outlines important disciplinary and non-disciplinary enforcement tools, such as educational letters and citations, that allow for proportionate responses to minor violations, and including the document in the disciplinary guidelines would formalize and reinforce the board's practice of using a range of actions based on the severity and context of any violations. Reference to the spectrum of administrative actions could possibly be added to CCR 1395.2, to the general considerations section of the disciplinary guidelines, or wherever regulatory counsel would recommend as appropriate. So again, I want to thank you for the proposed revisions and for your consideration now of possibly incorporating reference to the spectrum of administrative actions. And finally, just as a quick note, we noticed a typo that in the table of contents of the disciplinary guidelines, section 3B, standard terms and conditions are 15 to 32, not 14 to 32. So you might want to, just wanted to bring that to your attention. Thank you very much again for your work on this and for your consideration of these additional requests. Thanks.
Thank you, Dr. Winkleman. Just a little bit of housekeeping for the comments. I forgot to mention that let's limit it to 2 minutes. And if someone has said something similar, you can feel free to agree to it and just add to it. Thank you so much. Okay, next person, please. Thank you.
Hello, my name is Dr. Robert Teal. I wanted to reiterate everything that Mrs. Winkleman said. We really appreciate you guys looking over the disciplinary guidelines and making some what we believe to be beneficial changes. So thank you again for that. I wanted to also reiterate the importance or the recommendation of adding the spectrum of administrative guidelines. I think that would be wonderful. There's one last thing that I'd like for you all to consider if you're willing. The current guidelines only having a minimum or maximum, we believe that there's some anchoring effects to that. And we would like you to consider a moderate category in there with just a couple of examples, because I think a lot of these infractions do seek a moderate disciplinary action rather than just a minimum or maximum. So I think that might help the process as well. I appreciate your time. Thank you again.
Thank you, Dr. Teal. Any other public comments? Seeing none, let's bring it back to the board. Any other board discussion?
I would be interested in what it would take to add the spectrum of administrative guidelines to the disciplinary. Is that doable?
Adding it?
Adding.
Yes, it's doable. If the board so wanted it, it's something we could do.
Because I think that the more clarity on the disciplinary guidelines that we can give, if that's helpful, then that might be something to pursue.
Does it take a motion? Will it take a motion to do that?
We have a motion drafted, but if they wanted to add the spectrum of administrative guidelines.
You have to vote down the motion.
Vote down the motion. Okay.
And then make a new motion.
Okay.
Okay. So we have a motion in front of us, and we will call the roll.
Tate, Rogers, Kasuga,
No.
Cervantes,
No.
Harbsheets,
No.
Boo, Nystrom,
No.
Rescate.
No.
Motion does not pass.
Okay. Right now, let's consider, does anyone have another motion?
I will make another motion.
Okay, Dr. Harbsheets.
And I would like the motion to represent what Ms. Messia read regarding the optional psychological evaluation. Could you read them again so we have them for the motion?
Dr. Hershey, can I please read a motion?
Oh, sure. Yes, you can.
To approve the proposed regulatory text for section 1395.2 and the form incorporated by reference, direct staff to submit the text to the Director of the Department of Consumer Affairs and Business Consumer Services and Housing Agency for review, and if no adverse comments are received, authorize the executive officer to take all the necessary steps to initiate the rulemaking process, make any non-substantive changes to the package, such as the table of contents that she described, and set the matter for a hearing if requested. If no adverse comments are received during the 45-day comment period and no hearing is requested, authorize the executive officer to take all the steps necessary to complete the rulemaking and adopt the proposed regulation of section 1395.2 and the form incorporated by reference as noticed.
How would we change the 60 days to 90 days in that motion? And does that include adding the the spectrum of administrative action.
You can add the 60 and,
Okay, so
and change the 60 days to the 90
change the
days.
60 days to 90 and add the spectrum of administrative actions. That's the motion.
Do I get a second?
Second.
Okay, it's been moved by Dr. Harpsheets and second by Ms. Nystrom. Do we have any further board discussion? Seeing none, let's bring it back to public comment. Seeing none, can we call the roll?
Tate, Rogers, Kasuga,
Aye.
Cervantes,
Aye.
Harpshiets,
Aye.
Fu, Nystrom,
Aye.
Riscate.
Aye.
Thank you. Motion passes.
All right, thank you. So now we go back to agenda item.
Would you want to continue with item number 22?
So let's go.
22B.
Okay, yeah, so let's go move forward with 22D.
Okay, thank you. So this package is the standard for, practice for telehealth services. This package is in the initial stage. Since our last meeting, staff completed all of the production documents and submitted them to the Office of Administrative Law, OAL. The notice of proposed action, initial statement of reasons, and proposed text were officially approved and published on October 17th, 2025. Ahead of publication, we posted everything on the board's regulations webpage and sent notice to licensees, board members, and interested parties on October 15th, 2025. We also shared the information through email, social media, and provided hard copies upon request, making sure the public had multiple ways to access these documents. As of October 17, 2025, the 45-day public comment period has officially begun. So far, no requests for a hearing and no public comments have been submitted to the board.
Thank you. And do we have a possible motion for this one, or this is this is just like for watch?
It's just an update on the telehealth.
Okay,
Yes.
so for the rest of the regulatory updates, it's going to be just like
Information only.
information only. So can you keep going, Cynthia?
For the remainder of the packages, if you have any questions, please let me know. Other than that, they're informational only.
We can
Well,
take question. We can take board comment at the end.
At the end of at the end of G, as well as public comments. Thank you.
So do you want me to provide an update for each package?
No.
Oh, okay.
That's right. We're going to take a public comment now.
Okay. Is there any public comment on agenda item 22C to G? Seeing none, we'll move on to
Okay.
agenda item.
Go back to item 14.
I just have a board comment on 22 before we move on.
Okay.
I think it was very wise of us to extend to 90-day the period for finding a practice monitor. And the reason why I think it's significant is because I appreciate our staff and all of the work that they do. But if we're asking them to have judgment individually on a case-by-case basis, there's time and the potential for maybe inconsistencies to develop. And so I think this is it just helps and takes out the decision. And I think that's a better approach to how we think about our regulatory packages. I just wanted to say that. Thank you.
Appreciate
you,
that, Dr. Cervantes. I'll bring it back to Dr. Harpsheets for her.
Okay, thank you. Okay, we will go to item number 14. Mr. Phillips, could you provide the enforcement report? And that begins on page 35 of the packet, the board packet. welcome in your new position as of November 1st, Mr. Phillips.
Thank you.
Thank you. Thank you very much.
Thank you very much.
Mhm.
The enforcement report is the overview of enforcement activity, conveying complaint, investigation, and discipline statistics to date for the current fiscal year and the most recent performance measures. The board has hired Daniel Phillips, former enforcement analyst, as a new enforcement program manager effective November 1, 2025. The enforcement unit has 2 staff members on leave and 2 vacant positions. Interviews for one of the vacant positions has already begun and should be completed in late October. Complaint program. Since July 1, 2025, the board has received 355 complaints. All complaints received are open and assigned to an enforcement analyst. Citation program. Since July 1, 2025, the board has issued 2 enforcement citations. Citation and fines are issued for minor violations. Discipline program. Since July 1, 2025, the board has referred 11 cases to the Office of the Attorney General for formal discipline. Probation program. Enforcement staff is currently monitoring 20 active probationers. There are currently 10 told probationers. Attachments. Attachment number 1 is the overview of enforcement activity, and attachment number 2 is the performance measures. And this item is for informational purposes only. Thank you.
Any board comments? Public comment. Please come to the front if you have a public comment you would like to make about the enforcement report. Okay. Seeing none. Thank you, Mr. Phillips.
Thank you.
We will move on to the budget report, and Ms. Mancia, you could please give us the budget report, and that begins on, going through all the enforcement pages. The budget report begins on page 50 of the packet.
Thank you. The new fiscal year began July 1st, 2025, and the figures that are on the document today are based on our September totals, which represent the fiscal month FM2 reporting period. For this fiscal year, the board is projected to bring about $9.3 million in total revenue. As of the end of September, we've collected $1.76 million so far. In terms of expenditures, our total budgeted expenditures for the year are $7.94 million. We're currently projecting to spend about $7.89 million, which would leave us with a positive balance of $46,000, approximately $46,000 by the end of the year. Any questions from the board?
Board members, any questions, comments on the budget? Any public comment? Okay, thank you. Item number 16 is the Outreach and Communications Committee report and consideration of possible action on committee recommendations. Dr. Rogers is the chairperson of that. Are you prepared, Dr. Kasuga, to speak for her?
Yes. Okay, so we'll start off with Mr. Burke for agenda item 16A.
Thank you, Dr. Kasuga. So included in hand carry, the hand carry packet 1, numbered number 1, is our strategic plan action plan. The action plan is generated after the strategic plan is developed. It covers the same period, 4 years, 2024 to 2028, and it sort of breaks down specific tasks and goals per unit. So provided is an updated action plan where you can see some items have been completed, some have been pushed back. Quite a few items are labeled ongoing, so they are happening. That's that. This year being our sunset year, it meant that that's taken a lot of staff's time and effort generating the report, working with the legislature. So a few items that were listed as happening in 2025 haven't. They will happen in 2026. Happy to answer any questions the board may have.
Any board comment? Any public comment on the strategic plan update? Okay. Social media update?
Okay, so I'll ask Ms. Whitney to present item 16B.
Thank you, Dr. Kasuga. So for the social media update, we did add a LinkedIn page to the board last year. We have been sharing our similar items for our Facebook and our X account. For example, we're sharing meeting notices, licensing timeframes. We're also sharing stakeholder information such as the ASPPB surveys and the town hall meetings, just to give extra exposure to those events. And then we do have the views for our YouTube videos for continuing professional development on there that we did in 2024. And then in our September outreach committee meeting, it was brought up that some of our meetings were not in YouTube format on our website available for viewing. So we have uploaded all of those. So everything is now on our website and available to the public or staff or board members, whoever may wish to view them. And we have ensured that they will be uploaded timely in the future. And the other item to note is we do have all the 2025 meetings that were available on the website and the views for those. And then we also have the 2024 data. The way we had always reported the information before was by calendar year. So we just started with the meetings in 2025 through the outreach meeting in September. So at the outreach meeting, Dr. Rogers asked to have a complete picture of the prior year. So we would be adding in the outreach meeting in November. So you guys will have a full cycle for the next reporting at the outreach next year moving forward. Any board questions?
I'm just wondering, and maybe you said this, why there was no data for the licensure meetings during 2025?
Because they were not uploaded to our website. In the past, we've always had our meetings done via WebEx. They got converted into YouTube and then posted on our website with us having to do anything. We realized during this meeting that that wasn't happening. Due to whatever circumstances. We had never had to do anything before. Now we're having to reach out and have our support teams actually do that. So we're having to, there's a new process for it that we weren't aware of. So.
Okay. Yeah. There were several hundred people at each of those meetings. So
correct.
Well, that was significant.
Right. Yes, so that's why we didn't have the data for some of them. Be transparent. You know, we wanted to let you know that we didn't have them posted on the website, unlike we thought they were.
Great, thank you. Any other board comment?
Just out of curiosity, with respect to the LinkedIn page, are you seeing that the following is increasing and the information is getting out there, or is it kind of stagnant? And
it's kind of hard to judge because we really don't get a lot of data from it, like how many views or anything like that on that type of stuff. Specifically to like Facebook and, you know, X, we used to be able to see viewers or followers and stuff like that. So we don't have that data anymore on those type. We used to report it out and now we don't.
Okay, thank you.
I think when we were during the meeting, we talked about just trying to put all our meetings out there and all our information, because we recognize that the public isn't always using one particular platform. And so that way we're able to reach more people by using the different social media things that we already have. And we can strategize more moving forward with like more data that we're collecting. But right now, we just wanted to make sure that, because sometimes there's information that's only on the Facebook page and not on the LinkedIn page. And right now, we want to make sure that all our information is on different social media platforms, and then we can have better data in the future as well.
Okay. You know, warranted, and there's a following, but I also recognize it takes time to grow that base as well.
Okay, thank you.
Okay. Any public comment? Please have a seat in front.
When you speak, you mind getting closer to the mic because you're saying lots of good stuff and it's hard.
Oh, sorry. Yes. Well,
thank you. Thank you for bringing that up.
Moving on to item 16C, It's the website statistics update, which is in line with what we're talking about.
Okay, so for the website statistics in the meeting materials, I'm not sure what page it's on. I apologize.
It's on page 57.
Okay, thank you.
Okay.
We have the top 5 viewed web pages from our board website for 2025 through August 31st, 2025. So from January 1 through August 31. They're very similar to the top 5 from last year. And then we've got a comparison of how many website hits on various pages on our website per quarter. And again, we cross-reference 2024, so you guys can kind of see the trends there. Any questions on the website statistics?
Seeing none, any public comments? Okay. Moving on to item 16D, Mr. Burke, it's the update on the newsletter.
Yes, thank you. The board, we published our spring newsletter, and we are currently compiling the articles for the fall newsletter. Normally we have a summer one. It didn't happen this year, for which I apologize. I'll take responsibility for that, but it's going to go out in December. And then next year we'll be back on our regular schedule of spring and summer and winter.
Mm-hmm. Okay, thank you.
Any board comment on the newsletter? Any public comment on the newsletter?
Okay, and the last item, I'll invite Mr. Burke again for outreach activities update.
Thank you. So just a few updates since our last meeting. Our CPD coordinator, Troy Polk, attended the CPA meeting. We were graciously invited down by CPA to attend their meeting from September the 11th to the 13th, and he answered many questions about continuing professional education and licensure, and he had a good time, so we're thankful for being able to attend that. We also attended the 3rd ASPPB town hall relating to the EPPP and the development of the new integrated EPPP. Not too many highlights. The board's letter was referenced several times during that meeting. Specifically, concerns were raised by stakeholders about the timeline. ASPPB currently plan to have the integrated EPPP in 2027, which, as we've said, is really soon for a change of that magnitude. They were, I'll say, non-committal on changing that. There was also no new information about the potential costs of the exam. But I know the meeting was well attended, and we did our part in disseminating that information at board meetings and through our various social media platforms and emails. So there were lots of California people in attendance. And finally, the ASPPB again, they also did a joint task analysis where they asked applicants and licensees to, it was an online sort of questionnaire about what people would like to see on the clinical exam. And it was reported at ASPPB's annual meeting that 25% of all the responses they received came from California, which I think is tremendous, because that is more or less the our percentage of licensees in the country. So it's wonderful that California's voice was heard, and hopefully has been heard by ASPPB. So those are the highlights of that's the outreach activities update. I'm happy to answer any questions. Thank you.
I have a question, Mr. Burke. Are there any future ASPPB events that were announced during the annual meeting for of note for our stakeholders?
None that I'm aware of, but anything that does come up, we will share through as we have been.
Okay, thank you.
Thank you.
Mr. Burke, you attended virtually the ASPPB meeting, not the town hall, but there.
Yes, I did. I attended the ASPPB annual meeting. Sorry, I didn't consider that sort of outreach. And my role there was I was the board's delegate. The board had decided to vote yes on the proposed bylaw changes. So I sat through the meeting and I voted yes on those bylaws. And there were a few amendments. I abstained on most of them because I hadn't been told I could accept them. And there was one change which proposed, which didn't make it through, which I voted no on because it was, it looked a bit too substantial to me. So yeah, that's what, yes, I attended the meeting.
Yes, thank you. That's outreach.
Yeah.
Mhm.
Any other board comment? Any public comment?
I believe in the last board meeting, one of the outreach events that was talked about was talking to the Texas Board of Psychology regarding their development of a test and the class action against ASPPB. I was just wondering if you were able to comment about anything that you learned during a discussion with Texas.
Since the last meeting, I haven't actually had any more discussions with Texas. They are pushing ahead with the exam. The Texas legislature has approved, I think, $1 million. It's at least $1 million for examination development, and they are currently in. They have a sort of committee exploring that, and they will be doing a similar. It'll be similar to what ASPPB is doing. There'll be a joint task analysis. I haven't heard about any town halls, and they haven't reached out to me. I haven't spoken to them since our last board meeting. Thank you.
You will talk a little bit more about that in item 23?
Yes.
Sort of.
Yes, not specifically, just ASPPB will be invited to our February board meeting in Sacramento to talk about the EPPP, and at some point next year, it's likely that we'll have a lot more conversations with Texas as the development of that exam happens.
Okay, thank you. Any other public comment? Okay, we will move on to number 17. Thank you, Dr. Kasuga. Ms. Chen, could you please come forward and give us the licensing report, which begins on page 64 of the combined packet.
Good morning, board members. Thank you, Dr. Hopsheets. As of October 10, 2025, we have 23,694 licensed psychologists, 1909 registered psychological associates, 110 registered psychological testing technicians, 73 research psychoanalysts, and 21 student research psychoanalysts. This includes 21,010 psychologists with current licenses and 1,836 in inactive status. Additionally, one psychologist is actively serving in the military and permitted to practice in a military setting, while two others are also serving but not permitted to provide psychological services. We also have 845 psychologists in retired status. Among the 1909 registered psychological associates, 60 are currently in inactive status following the new regulations that allow them to request this status beginning of this year. More details can be found in Attachment A, the licensing population report, which provides a snapshot of license and registration statuses at the time the report was generated. And compared to the last report presented at the August board meeting, the number of psychologists with current licenses increased by 102. The number of registered psychological associates increased by 3. Retired psychologists increased by 43. And psychological testing technicians increased by 2. And Attachment B contains the workload data for psychologist licenses, psychological associate registration, and psychological testing technicians registrations from April through September 2025. In August, we received 2 research psychoanalyst applications, and initial review were completed in September. As reported at the last board meeting, we anticipated and observed an increase in the volume of open psychological associate applications, which is consistent with historical trends that we have observed. To address this uptick, we reallocated resources and successfully managed the increased workload. We try to ensure timely review and processing over the past several months as reflected in the accompanying chart. Attachment C provides data on applications and notifications received over a 12-month period from October 2024 through September 2025. The total number increased by approximately 35 compared to the same period in 2023 through 2024. Seasonal patterns also remain consistent. Then regarding average processing timeframes, the board reviews applications on a first-come, first-served basis. This includes but not limited to all applications, supporting materials, and responses to deficiencies, which are processed in the order received. Attachment D provides a 6-month overview of average processing timeframes in business days. For psychologist applications, we've mostly maintained consistent processing timeframes since the last board meeting. On average, applicants receive review outcomes within 3 business weeks per step. For psychological associate applications, processing times have returned to moderate levels as we move past the peak season. For psychological testing technicians registrations, we are actively working to reduce the previously extended timeframes for notification and deficiency reviews. This balancing effort has had a moderate impact in the initial review timeframes. As we continue to manage the workload resulting from the peak season, staff still recommends that applicants carefully review their submissions for completeness to help avoid unnecessary delays. This concludes my report, and I'm available for any questions that you may have. Thank you.
Board members, any questions?
I have a comment. I just want to comment how much I know I appreciate this report, and I am noticing an evolution. This report is very robust, describing the different ways that staffing is addressing surges in applications. We have 4 registrations. That's also an evolution in recent years, and I just think it's a new standard. And I am just like, that's just perfect. Thank you, Ms. Chung.
Thank you.
You have really seamlessly taken on these 2 additional categories, your department. Thank you so much.
Thank you. It's all staff. Without them, we cannot do this.
I know you just reviewed this in like 2 minutes, your whole report, but we know that was like a long runway here.
Yeah.
And so thank you.
Any other board comment or questions? Any public comment? Okay. Thank you, Ms. Chung. Would you might as well stay up because you're number 19 also. Okay. Mr. Polk, could you please come to give us the continuing professional development and renewals report? That begins on page 75 of the packet.
Sorry about that. Good morning and thank you. Included in the meeting materials, which begin on page 75 of the combined materials, are the reports for continuing professional development and renewals. Attachment A on page 77 shows the percentage of renewals that were submitted online versus mailed in. For January through September of 2025, an average of 93% of psychologists and psychological associates renewed online using the Breeze system, with an average of 7% of licensees and registrants renewing by completing and mailing in the paper application for renewal. Attachment B on page 78 shows the percentages of types of renewals processed, also from January of 2025 through September of 2025. An average of 78% of psychologists renewed as active, with approximately 7% of psychologists renewing as inactive. The retirements count for approximately 2%, and psychological associates accounted for, on average, 11% of the monthly renewal applications. Psychological testing technicians, research psychoanalysts, and student research psychoanalysts account for approximately 1% of the renewals. For both Attachment A and Attachment B percentages, this information is still consistent with previous months and years for renewals. Audits for the CPD audits for the months of January through August of 2025 are reflected in Attachment C on page 79. Currently, 2% of licensees are selected at random based on each month's approved renewals. The pass rate reflected in the meeting materials is 74%, with 6% of the audits pending review, 19% of the audits awaiting submission of the CPD documentation, and 1% of the audits have failed. Currently, for the months of January, February, and March, the pass rate was 100%. Licensees for September audits were selected and initial notifications were sent out this week. Staff will continue to update the audit statistics as audits are sent and completed. Attachment D on page 80 is the updated chart that reflects the common activities that are used to complete the CPD requirements. The information provided was determined by using the completed audits from January through August of 2025 that passed. Still, the two most commonly used activities continue to be sponsored continuing education and peer consultation, followed by self-directed learning and supervision. However, more activities are being used to complete the CPD requirements, such as conference attendance, professional services, and attendance at this board's and committee meetings, where there has been a slight increase in hours completed for this activity. Staff will continue to compile current statistics and will continue to update the charts as more audits are conducted and reviewed, in part with staff updating the board on trends of CPD and the CPD activities. Lastly, attachment E, which begins on page 81, is the draft revised CPD courtesy form that the board offers to licensees to track their CPD hours. In September of 2025, staff made edits to the current version of the courtesy CPD reporting form. The edits were based on feedback the board received during previous board and committee meetings, as well as feedback received while audits were being conducted. The revisions are highlighted on the attached form. That includes my report, and I'm happy to answer any questions.
Any board questions or comments?
I have a question, but I lost my page here. Hold on a second.
Okay, I'll say one thing while you're
Okay,
looking
okay,
for
okay.
it. I just wanted to reiterate that licensed board members do provide, are subject to audit every time we renew our licenses. So every licensed board member
Yes.
gets audited.
Yes, every
time.
renewal cycle, yes.
Yes.
I just wanted to make a comment that I appreciate the changes that were done to the form. I know this is like it doesn't have to be submitted, but I find it really helpful, and all the I use it personally. So I just wanted to give a comment that I appreciate the changes that were added.
Yes, absolutely. And hopefully with the new revised courtesy form, like I said, it's not required for licensees to use the form. If they want to use their form, they're more than welcome to. Hopefully that it's a little more user friendly.
It is user friendly.
Yes.
Thank you. Appreciate it.
I have a question. Okay, so here's my question. This goes to the percentages of that have failed the audits. And you might have mentioned it, and I was reading and didn't pay attention. So sorry about that. Okay, here's my question. Do you on page 80, you have the pie chart that says the categories for the people who passed?
Yes.
Do you have similar data on those who failed, like why they failed? Was it a situation where they had maybe non-approved, they submitted non-approved, like
the providers
Yes.
are not on the
Yes.
register.
Yeah. So currently with the CPD audits of the 170 audits that were sent out between January and August 2025, currently I've only had 2 that failed.
Oh, okay.
So that's why I don't have a whole lot of information, but on the 2, it is dealing with sponsored continuing education, either completing the hours after the renewal period. So if they did 27 hours of continuing education, those hours were completed after the current renewal period or the audited renewal period. Or an instance that if they did complete hours for sponsored continuing education, it wasn't done through an approved CE provider.
Okay. That's a lot of data, though.
Yeah.
That's very precise.
So I think, can you just clarify for us if, for example, our license expires on October 31st, and say on October 1st, let's say it's mine, I submit my renewal online, but I haven't completed all the hours, but I do it before October 31st. Is that a problem?
Just as long as the hours were done within the 2-year renewal period.
Okay.
Yeah. So if any hours outside are completed before that 2-year renewal period, if you're submitting those hours for that 2-year renewal period that's being audited, those hours cannot count for that renewal period.
Okay.
Since they're done outside of the 2-year period.
Okay. But I still could renew it October 1st,
Yes.
but then get the rest of the hours October 15th.
Correct.
Okay. I think that's been a question in the past.
Yeah.
Somebody's nodding yes.
But you also are attesting on your renewal form.
That I've
you've
done that.
completed it.
Yes, that is
That's a really
also
good
true.
point because I'm attesting that I've
Correct.
done them all.
Yes. That's
How
correct.
how do you think we should handle that? I'm asking our attorney here.
It just has to be done within the 2-year period.
Okay. Okay. But it's a good point. Okay. Yes.
Mr. Polk, can you clarify again for the public what is considered as acceptable sponsored CEs, please?
Yes. So for CE courses, as long as the CE provider is approved by one of the approved CE entities or approved entities such as the American Psychological Association, California Psychological Association, California Medical Association, the Association of Black Psychologists, or if they're approved through the Accreditation Council for Continuing Medical Education.
Thank you so much.
Is National Register on there too?
Not currently.
They're not. Okay.
Yeah. So yeah.
to know.
So those are the current entities that, as long as the CE provider is approved through one of those entities, will accept it for CE.
And can you clarify again, Mr. Polk, is this information available on our website?
Yes, it is. On our website, we have under the quick links option on the right-hand side of our website, there is a link specifically for continuing professional development. Also to up the top under licensees, if they were to select that option, the link to continuing professional development is there. And we have the current requirements, which outlines the 4 different categories with all 15 activities that qualify for CPD and what's required as far as the record and how hours are credited.
Thank you so much.
And if people are not sure, they can contact you.
Yes, absolutely. Yes. The email is on the website. People can email me once I do receive an email, or if I do get a call directly and I speak with the licensees, I always give them my direct email and phone number as well, so they don't have to go through the email box directly. They can contact me directly.
Okay, great. Any public comment on continuing education and renewals? Thank you, Mr. Polk.
Thank you.
Ms. Chung will come back and give us the examination report, item 19. This starts on page 88 of the combined packet.
Thank you, Dr. Harpsheet. Please find the examination statistics from January to September 2025 provided on the memo. For the EPPP, the overall pass rate so far in 2025 is about 38%, while the overall pass rate amount first-time candidates is about 59%. These numbers are actually comparable to those reported at the last board meeting. It was 39% last time and 62% for overall and first-time candidates. When comparing rates to the previous 4 years, we see that results from January, March, June, and September 2025 are on average consistent with or even slightly higher than those of prior years. However, pass rates in February, April, and August were lower. For the CPLE, the Law and Ethics exam, the overall pass rate is about 76%, and the pass rate for the first-time test takers is about 78%, both of which are similar to the rates reported at the last board meeting. And looking at trends over the past 4 years, February, March, July, and August of this year show average or better performance, while January, April, June, and September were somewhat lower. And this concludes the report about the statistics, and I'm happy to answer any questions you may have. Thank you.
Thank you. Any board comment? Questions? Any public comment? Questions on the examinations report? Thank you, Ms. Chung.
Thank you.
Moving on to item number 20, Legislative and Regulatory Affairs Committee update, Dr. Kasuga.
Okay. I'll turn it over to Ms. Mencia for the legislative updates.
Yes, and since we've already covered the regulatory portion, I will only be updating on legislation. Okay. So my update will be structured a little differently today. Instead of going through the bills in the usual order as they are written in the agenda, I'll be grouping them by legislative outcome. I'll begin with the bills where the board took an active position that were approved by the governor, then move on to the bills with an active position that were vetoed, and finally, I'll cover the bills that were held in committee and have become two-year bills. Starting with SB 775, the Board of Psychology and Board of Behavioral Sciences. This is the board sunset bill, which extends authority through January 1st. The board is currently implementing SB 775. SB 775 was approved by the governor. Also approved by the governor, AB 82, Reproductive and Gender Affirming Healthcare Protections, which expands the legal protections for providers, staff, volunteers, patients, providing reproductive, gender, and affirming care. The board is currently implementing AB 82. AB 489 was also approved by the governor. This is the Artificial Intelligence and Healthcare Bill, which makes it illegal for AI systems identifying themselves as licensed mental health professionals. The board is currently implementing AB 489. SB 160, background checks, which provides the board the authority to require background checks for all of its programs. This bill was also approved by the governor, and the board is currently implementing SB 160. Also approved is SB 402, Autism Services, which ensures health insurance coverage for autism treatment and provides the board authority to regulate autism service providers. The board is currently implementing SB 402. Lastly, SB 470, also approved by the governor, which extends the sunset date to January 1st, 2030 for current teleconferencing options under the Bagley-Keene Open Meeting Act. The board already meets these requirements and no further implementation is needed. Vetoed by the governor of bills with active position, only one, SB 641, which is the Emergency Licensing Flexibility. This bill would have allowed DCA boards to waive certain licensing fees, education and exam requirements for individuals in disaster declared areas. Held in committee for bills with active position, SB 579, Mental Health and Artificial Intelligence Working Group. This bill would have created a statewide group to study how AI is used in mental health settings, benefits, risks, and training. Moving on to watch position bills. Oh,
We'll have like questions first on the active bills. And I'll start off with Ms. Mencia. Can you talk a little bit about when you say that the board is currently enacting these bills? Can you give us a little bit of information on what that means?
yes. So for the 6 bills that were approved by the governor, of those 5 do require that the board provide either advisory to its licensees. So for example, I'll say with SB 775, that one was a really, really big bill with a lot of changes that will need to be made by board staff. One of those changes would be the out-of-state practice. That was changed from 30 non-consecutive days to 30 consecutive days. So we do need to make sure we update our website, update our laws and regs book, make sure that we provide advisory to our licensees and make that information public so that anybody that is coming from out of state that would like to temporary practice in California would know that that's a new that SB 775 has now changed that. And we have been receiving questions. So that's, as an example, that's one of the implementation plans just specifically for BPC 2912, which is the out-of-state practice, among the many that were that have changes.
I think what would be helpful for for meetings would be, I really like how you're presenting it, where you're separating the ones that the active positions that the board is enacting, and the ones that are, either vetoed or are still, in like going to be continued for a future legislative session. So but I think it would be helpful for us to kind of like have a little bit of summary of what the board is doing once a bill is passed, and also so we can provide information to relevant stakeholders more effectively with regards to some of this bills that you're saying that the board has more involvement.
Just absolutely. The process that we currently have is once a bill is chaptered, we then start preparing. Well, we're preparing beforehand, but that's when we have a deadline. This bill is going to be effective here. We need to have breeze changes in place because you need to request those. If there's regulations, we need to draft those, and there'll be some regulations coming to you at the next meeting, which are implementing changes which have come about from these. So we meet at the staff level, the unit level. We have a meeting next week with the Board of Behavioral Sciences because they currently have the out-of-state mechanism and the language essentially mirrors theirs. So yes, it's no problem. These documents all do exist. It's it's a detailed implementation matrix. It's really about what systems and processes we need to change internally to implement this law. So yeah, happy to provide that, and these items.
And it doesn't have to be all the nitty gritty about the little things, but it's more like kind of like in general, what are some of the things that are being done. So I think that would be like
okay, yeah, absolutely
helpful.
Any other board questions for the agenda item 20A?
I have a comment. I just want to encourage us, although I know we'll talk about this in committee, on the spirit of SB 579 Mental Health and AI Working Group, and that what I want to encourage is that we continue to prioritize keeping an eye on this bill and other similar legislation that may come about in the next year, so that we're properly anticipating, weighing in on the legislation and anticipating what might need to change in our regulatory schemes.
Yeah, definitely. Thank you. Yeah, it's definitely the AI, any AI legislation we're keeping an eye out on, and any advancements in or changes in technology as it relates to the practice of psychology. Okay.
Yeah, yes, we can. We do that. We have a tracking system, and you can have keywords and specific sections of code. Anything is introduced that interferes with or proposes to make these changes, it's flagged, and then we do an internal review to determine, okay, is this a watch? Is this one we'll need to do a detailed analysis on? So yes, we'll. I'd be shocked if it wasn't already in there, but anything with artificial intelligence and the healthcare code would be flagged immediately.
Because I think, what I think about all the time is the of our stakeholders, those who are who touch through their day jobs, recent graduates or current doctoral level students who are coming into licensure, is a concern of mine. Just that when we talk about things here, we agendize things here, we have reports, we're giving them insight into what they can anticipate for their students, for those licensees in the future. And I think that is a very important function of what we do.
Yeah. And also it's a community effort as well, because like sometimes when I see legislation, for instance, I also like send it to the board, and we have like we're always open to our stakeholders to submit bills that we should be paying attention to. So it's like a community effort in terms of making sure that we don't miss any of these important bills and be able to weigh in at the right time as well, because sometimes it's all in the timing of when we receive them and when we can meet in committee as well. So that's all part of the equation as well. Any other board discussion, comments? Let's open it up to the public. Any public comment on agenda item 20A? Seeing none, let's move on to agenda item 20B, watch bills. And this is all for information only. And I'll open it up to Ms. Mencia.
Yes. So with the watch bills, as I did with the bills with active position, I will list out which bills were approved, which were vetoed, and which were held in committee. Beginning with SB 518, this bill was approved by the governor. This is a bill which establishes a new state bureau to verify descendancy and oversee reparations, payments, and payments to eligible descendants of enslaved individuals. Vetoed by the governor, there are two watch bills that were vetoed by the governor, and that is AB 81, which would have required the State Department of Veterans Affairs to fund a study on women veterans' mental health, and AB 742, which would have given priority in license application review to individuals who are descendants of enslaved persons. The remaining bills were held in committee, the remaining watch bills, which are AB 257, which created a grant program to support telehealth and virtual specialty care networks across California. AB 277, which requires background checks for employees in behavioral health facilities and programs. AB 346, which clarifies that only licensed healthcare professionals can provide required certifications. AB 479, which provides a process for removing certain criminal convictions when they were connected to experiences of domestic violence. And lastly, AB 667, which requires licensing boards to provide interpreters for applicants taking exams in their professional field. For all the bills that are held in committee, both watch and active position, I will continue to track them in the next legislative cycle, which begins January 1st, 2026.
Thank you. Any questions from the board? Seeing none, any public comments or questions? Seeing none, let's move on to agenda item number 21, legislative items for future meeting. Oh, thank you, Ms. Mencia.
In case they do have any, I want to write
Okay.
it down.
Legislative items for future meeting. The committee may discuss other items of legislation in sufficient detail to determine whether such items should be on a future committee or board meeting agenda, and or whether to hold a special meeting of the committee or board to discuss such items pursuant to Government Code Section 11125.4. Any legislative items, board members? Seeing none, let's open up to the public. Any legislative items for future meeting? Okay, seeing none, that completes agenda item number 21. Let's move on to
22.
We
Dr.
finished
Kasuga.
22.
22 is the regulatory update, review of possible changes.
Oh, we did that one.
We did it.
Oh yeah, that's right. We did that before. Did we do all of it?
Yes.
Yes,
We did. Okay,
Yeah,
okay.
up to G.
Okay, thank you, Dr. Kasuga.
Thank you so much.
Okay.
And thank you, Ms. Mencia.
Thank you.
Okay. Item 23, Mr. Berg, update and discussion on the development of the integrated examination for professional practice in psychology.
Thank you, Dr. Harbsheets. So this is an informational item. There hasn't been a tremendous amount of movement or update since the last meeting, and certainly not since I already spoke on most of this under the outreach update. So ASPPB is continuing to develop the integrated EPPP, as it's called. They have been doing a number of town halls, which I've already spoken on, and I expressed that there's no really new information that's come out. We just know that it's happening, but there's no firm information as to the cost, as to the timeline, although it was sort of implied at the last town hall that there will not, it is going to be 2027. They wouldn't commit to anything. I already mentioned that our letter was brought up, which is great. That means that it's out there and people are looking at it. The job task analysis of the practice of psychology, it was completed by licensed psychologists. It closed on September 29th, and it happens every 7 to 10 years and directly shapes the exam specifications and content used to evaluate the knowledge and skills required for licensure. So as I said, it's wonderful that 25%, a full quarter of all of the responses came from California. So it means that our licensees, our peoples are making themselves heard, and I think it's great. And I'd like to think had a part in that with our outreach campaign and talking about it. The plan is to have ASPPB attend the February board meeting in Sacramento, where hopefully there'll have been some firmer developments, which we can talk to them about and ask questions. And if there haven't been, maybe we could ask them why. That would be good. Insofar as conversations with Texas, I haven't had direct conversations with Texas since the last board meeting. They are. Their legislature has approved money for the development of the exam, and they are doing. There's a steering committee that they've formed. I'm not sure who's on it. They did invite us to sit on it, but it was thought that's premature because we're still having good faith. This is a conversation with Dr. Tate I had. I didn't make that decision. We're still in what I think are good faith conversations with ASPPB about the development of the EPPP. So to jump on board with Texas seems premature. The board may wish to invite Texas to come to a meeting in 2026, possibly the May board meeting, so they can just give their update on where that examination is. That's really all that's happening in the space from my perspective. So that's the EPPP update.
Any board comment? I have a question, and I'm not sure you can answer this. I'm just interested in your thoughts. Since ASPPB seems to be pretty firm on rolling out this new exam in 2027, and we recognize that that's not really feasible for us in California, recognizing the lead time that we need. What are some of your thoughts about what would we be facing if that happens? I mean, I know it's very premature to even ask that, but I just wondered if you had any thoughts.
Just in terms of the implementation, I mean, any new exam, the Office of Professional Examination Services would need to scrutinize it to make sure it complies with, is it Business Professions Code 128? Forgive me, I don't have the chapter and verse right in my head. So that would take time. There would be regulatory change if they continue with the idea that you will only be able to take this new exam at the end of all of your supervised professional experience hours and not once you've completed your coursework. We would have to change California statute. That's not impossible, but it's very tight, and we would really need to know very soon, what the exam is going to look like, how much it's going to cost, and what their firm implementation date is. We'd almost certainly need to have a period of time where the older form of the exam, without the integrated portion, was valid alongside the new EPPP, because there are people who will have already paid for the exam as it exists now, that have been preparing for that one, that have been approved to take that version, not the new one. So there will be need to be some period of overlap built in. So I'm probably missing some things.
Well, so one of the issues I think we will face, right, is that we have authorized for individuals to take the exam when they complete coursework, but ASPPB is suggesting that with the new exam, it not be taken until it sounds like even their postdoctoral internship hours. Is that correct?
Yeah, I believe so. It would be the very final step because they want there'll be a new component, the competency-based component within the examination. Obviously, you'll have had to have been doing supervised practice probably before you're able to do that. But what that will then do is it will push out, potentially a year and a half, 2 years from when you've completed your coursework, which is why we changed the law in the first place to try and address the issues of California having really quite low passage rates overall.
So if we adopted the EPPP2 for California, and if we did that, then what would we have to change?
It would be that the law that we changed with, I forget the bill number. It was last year, but they all many numbers, they all blur together. We would need to go and amend that statute.
I know Ms. Chung has information on that for us.
Yes, well, you're asking about the potential changes that we would have to do and challenges. So yes, please.
Yeah.
I've exhausted my knowledge.
Yes, there's a lot.
Yeah, Mr. Burke, I think you were referring to AB 282 is the law that you
That's
were
the one.
referring to. Yeah. So regarding your questions, if that happened, we would have to further change our regulations because right now, the regulatory package that Ms. Menzier updated earlier is really tailored to make AB 282 happen. So it really depends on how it goes, and then we need to build in some time frame to allow the regulation process to go through, because AB 282 was passed like 2024, and then so we're still working on the reg package. So as we all know that it's a process, there for us to do that.
And one of the reasons for the delay in that regulatory package is thanks to ASPPB's abrupt abandonment of the EPPP2. So we had to expunge that language from the regulations, get those reapproved by the board, and re-prepare and draft the documents. So, yeah.
Just for those following along, the ASPPB had proposed the EPPP2, which is now being called the Integrated Examination of Professional Practice in Psychology. Just want to make sure everyone follows. We're talking about this.
And it's just one exam now.
Now it's one exam.
Oh, I'm sorry. In the meeting hand carry materials, there is quite a detailed memo of the history of the board's interaction with the EPPP2, the changes that they made, and now it's the integrated EPPP, and a letter that the board sent to ASPPB in May based on issues that the board had at our May board meeting in Berkeley, where ASPPB were in attendance. So if there's more detail that you would like on the history of this subject, it is in the materials. Sorry, yeah.
So this might be a difficult question, but could you share with us, Mr. Burke, what you anticipate for 2027? What do you, I know that there's a lot up in the air, but what are your thoughts about what we as a board and maybe the profession in California, especially people coming into the profession, will be looking at as 2027 unfolds, or say even 2026 into 2027?
Well, next year we'll obviously be monitoring any updates and any actual information that comes out from ASPPB. As I mentioned, the cost, the timeline, whether or not they'll be allowed to take it after their coursework or at the end. It's really just reacting, and it's unfortunate. We can be proactive on some things, but until we have that information, we can't draft a reg package. We can't prepare. We can't really do anything. So we're at the mercy of ASPPB sharing information and when they do it. So it's I anticipate it'll be more information gathering, more discussions until we get some firm answers. Because I'm not sure they know yet, or if they do, they haven't divulged it to membership or That's certainly not at the town halls.
Right. Well, I guess I would just want to say that I would hope as a board that we would stay aware of what are our choices versus being in a reactionary mode to whatever ASPPB decides. What do we want to do in California? And we don't lose sight of that.
And I would just add to our stakeholders who teach or are involved with recent graduates to stay connected to our meetings, our board materials that contain additional information so that you can weigh in and also support your current doctoral students who will be affected by these changes, potential changes, I should say.
I think it's good to evaluate a little bit like what we will need. And so we can provide ASPPB some of our kind of like timelines, because then they will have to consider that, provide us like the information we will need in those crossroad timelines that we will need in order to function and to enact any changes.
So, I mean, as Mr. Burke has said before, we have 25% of the licensees in this country, and we're continuing to produce a significant number of licensees.
100 just from the last one.
Yes, yeah.
Yeah. So I think that's good to kind of like let them know our timeline, so then we can, you know, be as proactive as we can. And because technically they work for the jurisdictions, and they have to be they have to provide us the information we need when we need them in order for us to function, do our functions as a board. So we can send them a letter or with those timelines. That way we can get more timely answers from them.
Yes, this obviously will be on the February. It'll be on all future board meeting agendas for the foreseeable future, as well as the relevant committee meetings. Certainly licensing. Certainly, once we're actually developing language, the legislative and regulatory committee. For the February meeting, we can put together an implementation similar to what we do for actual chaptered legislation, because we do know this is coming. We can draft what changes we need to do and a potential timeline for each one, which we can share with them prior to that meeting and discuss with them, hopefully, that they confirm their attendance at the February board meeting. So yes, absolutely. Thank you.
Thank you.
Thank you. Any other board comment? Any public comment?
Hello, Dr. Elizabeth Winkleman again with the California Psychological Association. I just wanted to mention, so CPA did sponsor AB 282. That was the streamlining statute that would allow people to take the trainees to take the exam after they had completed all of their coursework. And I think one thing that could really help to maintain that goal and allow that flexibility and potentially increase the pass rates is that even if the EPPP is becoming integrated, they have not mandated as of yet. I know they've said they're thinking about it, of mandating completing all the supervised professional experience prior to taking the exam. But I think one way that would simplify things and again maintain the goals of 282 would simply be if they're going to do the integrated exam in 2027, allowing the states to determine when, what needs to be completed before they take that, as opposed to making that a mandate. And I think that might be a lot easier all around if they can be if they would accept that. They may not, I realize it, but there are going to be issues with other states as well in terms of implementation and their own specific requirements. And it has been discussed, we're a big state in terms of the number of psychologists. And I think they can meet the goals of their integrated exam without mandating completion of all the SPE beforehand, because many people have a lot of experience before they have completed their coursework, have a lot of clinical experience. And also, it's not a mandate that people take it right after they finish their coursework. It just allows for that flexibility. So we will also, CPA will also be at the next board meeting, and will certainly be raising any concerns or suggestions with the ASPPB then as well. But thank you.
Thank you.
Thank you.
Hi, Robert Teal. So thank you again for being open to also looking into what Texas is developing and just kind of opening, keeping an open mind on what is going to be best for the profession and protecting our patients. One thing that I remembered about AB 282 was it also allowed for there was a consecutive nature to the testing, finishing all the coursework, then doing the EPPP2, then doing the CPLE. And if I remember correctly, you could take the CPLE or before the EPPP. So as this continues, as you guys continue to talk with ASPPB, I would encourage the stipulation that allows applicants to still have some flexibility around taking the CPLE before the EPPP, because even if the EPPP is gated by a completion of all of the CPD and coursework, it would still be helpful for students to be able to take the CPL or complete that one even before the EPPP, because that would further eliminate gatekeeping and bring people into the field faster.
Thank you.
Thank you.
Any other public comment? Please come forward.
Hello, thank you for being here. This is my first time attending a board meeting. My name's Dr. Laura Cueva Miller. I just have a question, I'm an old licensed person. Is the intent with this integrative test to help licensing across states? Is that part of what is their intent?
Would you like to answer?
Do we know what the intent
answer
is?
that?
I can
I'm
answer.
sorry, I can answer a little bit.
Well, but you can't speak on behalf of
Got it.
ASPPB, so
Sorry.
you
Legally,
can
we
tell
can't
your
say
own
what they
thoughts.
say.
You can say your own thoughts. You can say what they say,
I can say
but
what they
this is
say.
not ASPPB.
Right.
Okay, yeah.
I could say what they say. What they have said is that they believe that a competency test is important to have beyond a knowledge test. And they see the original EPPP as a knowledge test. And that's why they initially introduced the EPPP2, which is competency. So that's skills. And that's their stated purpose behind it.
Okay. Thank you.
And welcome to attending.
Does that fit?
Yep, that was
Okay. Okay. Any other public comment? Okay. Item number 25 is recommendations for agenda items for future board meetings. Board may not discuss or take action on any matter during this public comment section, except to decide whether to place the matter on the agenda of a future meeting. Any board member suggestions for agenda items for future meetings?
I do. I always want to add mindfulness by Dr. Rogers if she is present. I also wanted to kind of make sure that we revisit SIPACT with some of the changes that that happened this year with regards to
That we continue to look at SIPACT.
Mm-hmm.
Thank you. Okay. Any other word ideas? Any comments, public comment for items, suggestions for items on an agenda for a future meeting?
Hi, my name is Anna Medina. Some instances like the DoD, Indian reservations, we can prescribe. Do you think that the board would support psychologists also prescribing in California in the future. Is that something where you guys are willing to pursue? Just curious.
Okay, thank you.
Thank you.
Any other public comment? Okay.
Oh, sorry. I just wanted to mention we did receive 2 written comments for this portion of the meeting. And I'm just going to pull them up now. They are located in hand carry packet 1 and hand carry packet 3 on our website. The one in hand carry 3 is it's a comment about mandating CPD in maternal mental health. And the other one in hand carry package 1 is it's a letter requesting that the board not only require examination, but an alternative pathway to licensure, a transitional supervised practice license is what the letter references, and that's the transitional supervised practice license is in hand carry package 1 on our website, and the maternal mental health CPD letter is in hand carry 3.
And we had an EPPP also public letter. That was
That item, yeah, we did receive that, and that was a public comment on item 23 that we just discussed.
Okay.
And that's available in hand carry item number 2.
And just wanted to reiterate to invite ASPP before the February meeting if possible. Thank you.
okay. That concludes our November Board of Psychology meeting. And the meeting will now adjourn. It is
Gavel.
10:43.
You get to gavel.
Oh, well, here we go.
Thank you, board staff, for everything.
And Mr. Polk, would you please come up and tell us the CPD credit for people who are in attendance?
Thank you for attending the board meeting today. For attending the full duration of today's meeting, 2 hours under CPD category number 1, attendance at a California Board of Psychology meeting will be credited. For your CPD records, please note today's date as November 7th, 2025, the name of today's meeting, which is board meeting, and 2 hours for your records. Again, please maintain this record as certificates of attendance will not be provided after the meeting. Again, since today's meeting was designated as an in-person meeting, CPD credit will not be given for viewing the meeting through the WebEx, as the WebEx was for streaming purposes only, and there was no option to interact during the public comment periods. Thank you again for attending the board meeting, and please sign out on the attendance sheet before leaving today. Thank you.
Thank you, Mr. Polk.
Thank you.
Okay.